Well, during these winter months, you may notice that your joints feel tighter. Naturopathic Dr. Joyce Johnson back with us on tips on how to treat that winter joint pain. Good morning. Good to see you.
Good morning. Nice to see you too.
Yeah, so it is the colder months that we experience it, isn't it?
It is, right? Because what happens during the winter months is the cold tends to cause our muscles and joints to lose heat. They contract more. Maybe we're not more likely to go for a walk outside when it's cold. So we're becoming less mobile. So things tend to tighten up. But the good thing is that there are things that you can do to help alleviate some of this tightness, some of this stiffness that might be happening that's causing some pain. And the first thing I want to say is nutrition. Always start with what you eat. So everything that you're putting into your body is going to have a big impact on how your body feels. So first you want to start off with a diet that is more anti-inflammatory. So choose foods like omega-3. You can find that in food sources like salmon and walnuts and flax seeds, or you could do it in a supplement form. These have anti-inflammatory compounds in them. Another food to consider is turmeric. So turmeric is really nice. You often find it in curries and you can put it into stir fries. And it contains a compound called curcumin. It's kind of tough to say sometimes. And what that actually does is it's a compound also that battles inflammation in your body. And then incorporate some foods like onions are really great. They contain quercetin, which is another antioxidant that has the properties to decrease inflammation in your body. And even cooking with more garlic right now, we know allicin has good properties to help take down inflammation as well.
Okay, now I see to your right a bottle of glucosamine there. Now,
Yes.
I have some joint pain. I've got some hip issues. And I was actually at a store looking at the bottle, and a guy came up to me and tapped me and said, "Get it." And I have been taking it, and I don't know if I can, and I've been doing better, and I don't know if I can attribute it to that, but is there what's the clinical, any clinical trials in glucosamine, or is it all anecdotal?
Absolutely. So glucosamine and chondroitin, they probably, in terms of supplements, they have the most clinical studies associated with them and helping to alleviate arthritic pain. What they do is they actually help to rebuild the cartilage in the joints. So all of your joints are covered in a layer of cartilage. As we age and wear and tear, that cartilage starts to become rough. It starts to sort of break away. And what you need to do is be able to rebuild it. And that's what glucosamine and chondroitin attempt to do. I usually tell people it takes at least a minimum of 3 months before you notice any improvement in your joint stiffness or pain once you start taking it. But because we're always using our joints, it's kind of a long-term thing. You're trying to preserve that joint space so that you can maintain what you have rather than continue to see like a decrease.
Yeah. Now, are there natural sources for this?
Food sources, not really that you're going to see an appreciable amount of glucosamine or chondroitin. I mean, it comes from exoskeleton of crabs and fish, these types of things. So that's usually not the part that you're eating.
Right. Okay. And of course, as you mentioned, we got to limber up. Exercise is important.
Yes. So moving's really important. So one of the other reasons, like I said, was that the cold weather's linked to joint pain because you're less likely to go out and move when it's chilly and damp. But it's really important because movement is going to help lubricate your joints, help prevent the pain. And then adding in some resistance training is really important because you want to make sure that the muscles surrounding your affected sore joints are strong because they're going to help support you. So that's also extremely important. And with doing the weight training, it also can possibly lead to not gaining any extra weight. And I think this might be key for a lot of people.
Yeah, because that's so important to keep the weight off those joints. And we just have a second left, but hydration is important too. As you always tell us, drink water.
Yes.
Yeah. Hey, Happy New Year.
Absolutely.
Good to see you, Naturopathic Dr. Joyce Johnson.
Nice to see you.